So I started House Calls October 18th of 1993. And what was interesting is I had been working also in a federally qualified health center for uninsured patients. And those patients, I say, were disenfranchised from the health system because they didn't have insurance. Where the homebound, really, even though most of them have Medicare or other insurance, they're disenfranchised because they cannot get to the healthcare system. And so the healthcare system, we started taking it to them via house calls. Because of healthcare reform and the pressures that CEOs are under, both in terms of readmission penalties as well as long lengths of stay, I am actually batting 100% at getting buy-in at the CEO level. The trick is because this is so outside the box and so new that it's difficult to implement it in a health system because it's so outside the box.
If we weren't seeing these patients, these are the patients that are not getting primary care. They're going to end up in your ERs, they're going to end up in the hospital, there's transportation costs involved. And if you don't get home care involved, it's just going to be a revolving door for them. Because again, these are people that are not getting access to care. So it's meeting that triple aim of better health care outcomes, patient satisfaction, and still lowering the cost.
Well, that's pretty easy. It's bottom line. It's bottom line effective. And you need to know this, Mr. CFO, Ms. CFO. Hey, this is very efficient. You're keeping people out of these hospitals and you're avoiding unnecessary ER and admissions. And boy, in today's arena, that's very important.
Certain frail elderly can't be well served by an office setting. So we help to develop practices that come to the home of the frail elderly and provide the services they need.
So for 17 years we've been making house calls in Washington, D.C., and for the first probably 15 years it was considered kind of a nice thing to do. People would kind of pat you on the back and say, that's really nice of your team to do that. But it wasn't really a financially viable business because we would operate at a loss, because when you drive around and you get a small fee-for-service payment for Medicare, it's hard to break even doing this kind of work. So now it will give impetus to health systems to realize you can do well by doing good, and that you can take care of the sickest population in the community, keep them out of the hospital, but actually be rewarded and have a viable financial model.
From my perspective, HCCI needs to be the national enabler and create the platform as well as the content in the platform or platforms to help train those systems or those hospitals that want really to get into home-centered care.
I believe what we have now is a model that allows primary care practitioners to deliver that best quality care. So it's the best care for patients at the right time and those patients in the greatest need.
They'll reduce your risk going into this because there are so many things that you don't know what you don't know. And HCCI has just has that wealth of experience to be able to help navigate those waters.
HCCI can be an important piece in leading this house call movement across the country through different ways, by teaching them how to practice efficiently, how to be a good caring, competent provider in the home, and how to logistically make a house call program work.
Another one of the things that I can bring to somebody that makes me very, very happy is helping that family find some peace and some ideas on what they can do to help their loved one who's going through a serious illness. It's never just about the person I'm examining. There's a family, caregivers, friends, all those other people too, and being able to do something for that. I can go home every single night and say, I made a difference. No matter how hard the day was, I made a difference for somebody every single day I go to work. And I love that.
I think to go into home care medicine, you can find great joy in kind of taking care of some of the most vulnerable elders in our society. It's a sense, you do it for a sense of mission and dedication. At the end of the day, despite all the business and other financial issues that are kind of a challenge, I can go home and I feel like I really made an impact on people who needed it the most.
I love being at the patients' homes. There's nothing quite like it. I learned so much about you and about your dreams and your fears and your desires, how you want to be cared for. I learned so much of that being at your home and listening to you and spending time with you and your family and your loved ones.
People who don't necessarily need to be treated in the hospital will now be able to get that high quality care in their homes. So it's kind of like motherhood and apple pie. It's hard not to believe that this is the right way to go.